In this video, I'll be talking about domestic violence and how to approach a patient for the Step 2 CS exam. So, patients with violence will present with multiple injuries and bruises, over a long period of time. Like they might have a fractured arm, a fractured leg, bruises over the back, and the injuries will be scattered throughout her timeline. This happened 2 months ago, this happened 8 months ago. Sometimes they can present with non-specific pain that points to no diagnosis, and the patient is just coming repeatedly to the doctor for attention. In this video, I'm going to be talking about a patient who is a female who's been abused by her boyfriend or husband, and she has fractures and bruises. So it's not hard to diagnose that the patient is a victim of abuse. The hard part, I feel, is to try to get them open up and counsel. Because once you start asking them, how did you get this bruise or how did you get the fracture, they will try to cover it up by saying, I slipped and fell, I'm very clumsy, I don't know how I got this. So you're trying to get them open up. So there are a lot of phrases that you can use that will help the patient open up. A few examples are, you're telling me that you're clumsy, but your injuries do concern me. Is there something else that is going on? Or you could just ask them, how are things at home? Who do you live with? And how is your relationship with your husband? Another phrase that you could use is, I see many patients in my clinic who have problems that are similar to yours. I can help you if you tell me about it. Most likely the patient would start to open up at this point, but if you still feel like the patient is not opening up, maybe she's scared of her husband finding out. So in that case, you have to reassure the patient and reinforce confidentiality. You can tell her that, I will assure you that everything you tell me will remain confidential. If she has kids, you have to tell her that everything you say will remain confidential unless I have reason to believe that your children are being abused. In that case, I will have to report to Child Protective Services, but it is up to you whether you want to share it with me. You don't need to hide this information from the patient. You really need to tell them that if the children are being abused, you will report, and you can tell them beforehand. So let's say the patient starts opening up. What I like to do is, whatever the patient tells me, I use the same words that the patient uses and ask them back in a form of a question. So it's like a conversation. It transitions very smoothly, and you're not jumping and asking questions, and you're not being judgmental. For example, if the patient starts with, oh, it's my boyfriend, don't ask, oh, does he hurt you or does he beat you up? That is a very wrong thing to do, I feel. So if she starts saying, it's my boyfriend, you can ask her, what about your boyfriend? And then she might tell you, he gets really stressed at work. So you could ask her, what does he do when he gets stressed at work? She'll tell you, he yells at me and he screams. At this point, you can ask her, does he hurt you? Another scenario would be when she says, he drinks a lot. What does he do when he's drunk? So you're transitioning and you're not asking questions. So after this, the patient might tell you, yes, he pushed me down the stairs, he hurt me, but it's my fault. They are typically in denial and they tend to justify abuse, and they do not admit it that they are being abused. So in that case, what you say is very important. If she says it's all my fault, you have to tell her that you don't deserve to be treated this way. She will say, but he loves me. And you say, people who love you shouldn't hurt you or treat you this way. But he's so stressed at work. It's not okay for him to take out his stress on you. Then I would suggest that you start transitioning to counseling. So you take a pause, and once she says what she has to say, you could start by saying, do you know, over time these incidents tend to increase, and it is good to have a backup plan if they increase to a point where you are unable to handle it, or if you decide that you cannot tolerate this behavior anymore. So have you thought of a backup plan? Do you have a place to go, or do your friends and family know about it? And then if she says yes or no, depending on that, you counsel her further about the backup plan. Tell her that she could hide some cash and clothes in a bag and grab it and leave if things get worse. Tell her to inform her friends and family so that she can go to them for help. If she has no friends and family, she does not have financial support, you can always tell that you have a social worker that can help you find a place to live and work on your backup plan, and you will make an appointment with the social worker, and the social worker can come meet her after you're done with your examination and your encounter. You should counsel even more. You could also ask at this point if it's safe for her to go home today. You can tell her that it is she can always call you, but if she feels uncomfortable calling you, then she could call a helpline which is confidential and it's available 24/7, and that you will put the helpline number in the discharge instructions. You can also advise her that she can call 911. Now, when you're doing all this counseling, you're likely to run out of time, but I think counseling is more important than the examination. So I would suggest if just quickly examine the fractured area or the bruise and do a standard closure that you would do with any patient, saying that there could be a number of reasons why you're having your arm pain. It could be a simple muscle strain, or it could be a fracture. We will need to do some imaging of your arm, like an x-ray, to find out the cause for it. In the meantime, I would advise you to rest, and once we get back the results, I will let you know how we are going to treat it. During the closure, you could also tell her that it was very brave of you to open up to me today, and just know that you can do it next time as well. Take care of yourself, okay? And do you have any questions or concerns? And these are the don'ts. Do not be judgmental in any way. Do not be direct while asking your questions. Does he beat you? Did he push you off the stairs? Is he the reason you got the fracture? You are not supposed to be direct. Always transition it smoothly. Do not tell the patient what to do. Don't tell the patient directly, you should leave your husband or just call the cops. That's not your job, and the patient makes her own decisions, so you don't make the decisions for them, you can only advise them. And another thing I would suggest is avoid using the words like victim, abuse, and violence. Some extra points, maybe if you have time you could cover these as well. You should kind of want to screen for depression. In most patients, just ask Siggy Caps, and if you don't have time for Siggy Caps, you could also ask, how are you handling this? Do you have thoughts about hurting yourself, or are there any guns at home? That's all. I hope that was helpful. And just be confident in the exam, be empathetic, use the transitional phrases, and talk to patient like you would talk to someone you love, and that really kind of helps you talk properly. Keep practicing, and good luck for your exam. Stay awesome.